everyone, and thank you for joining us in this panel discussion about artificial intelligence in healthcare. My name is Anca Petre. I'm a pharmacist by training, and I am also the CEO of 23 Consulting, which is a company specialized in creating educational content about the latest tech trends in healthcare. I'll be your host today, and before digging into the topic of our panel, I just wanted to take a couple of minutes to set the basis of what artificial intelligence is before talking about applications in healthcare with our guest. The first thing we need to realize about artificial intelligence is that we interact with it almost on a daily basis. Although movies depict AI like this terrifying robots ready to take over the world, the reality is completely different. We use artificial intelligence, for instance, when we ask Siri or Alexa a question. These tools use what we call natural language processing and speech recognition to understand what our voice is saying and translate that into actions. Generally, artificial intelligence refers to any type of technique that enables machines to mimic human thinking. So in very simple words, what happens is that computer scientists look at the way that we humans think and act, and they pretty much try to reproduce the same patterns with machines. There are a lot of different techniques that are used by computer engineers to make machines intelligent, but they are all part of this very big family that we call artificial intelligence. Within this family, a couple of techniques are very well known, such as machine learning or deep learning. If we take machine learning, for instance, it works pretty much the same as our brain, and I'll take an example to illustrate that. If we as humans see a picture of a rugby and a tennis ball, we are immediately capable of differentiating between the two of them and naming them. But what our brain actually does is that it looks at the shape of the object, the size of the object, and even the color. And by combining all this data, our brain is able to identify the object. And so machine learning works pretty much the same way. Computer engineers give these algorithms pictures of tennis and rugby balls and ask them to identify which one's which. But in addition to that, engineers also give them the criteria such as the size, the color, or the shape that they need to look after. And by combining all this data, just like our brains, machines are able to identify which one is the rugby ball and which one is the tennis ball. Once you understand that, it's pretty simple to imagine what are some of the applications in healthcare. For instance, disease prevention and prediction, diagnosis, or even personalized treatments. And this is precisely what we'll be talking about today in our panel. Thank you, everyone, for joining us on this session. So after this short introduction of what artificial intelligence is, we will dig deeper into some of the applications with our wonderful speakers and guests today. The first thing that I will ask them to do is please introduce yourselves so we all know what your expertise or your point of view is. And because we are at a patients forum, I will ask Janek to introduce yourself first, please.
Hello, and thank you for the invitation. It is an honor to be here and represent the Estonian Chamber of Disabled People. And I'm also a founder of the Estonian IBD Association. And I'm also patient myself, have Crohn's disease more than 25 years. Thank you.
Thank you, Janek. Rintje?
Thank you, Anna. Also, thanks for the invitation. It's very nice to be here and to discuss this important topic. My name is Rintje Agricola. I'm an orthopedic surgeon from the Netherlands, and I do both research and work in practice as an orthopedic surgeon. And in both research and clinics, I use AI and and a lot of digital transformation of health where we're currently in. So happy to discuss that further.
Thank you, Rintje. Samir?
Thank you so much, Anca. Good afternoon, everyone. It's a pleasure to be here. And it's great to see this very elite panel of resources people. I'm Samir Pujari. I'm with the World Health Organization's Digital Health and Innovations Department, which sits within science of WHO. And I also co-chair the joint UN focus group on AI for health, which is trying to create benchmarking for AI for health. Excited to be here. Thank you. I'll come back to you.
Thank you very much. So as promised, we will start with some of the most exciting applications we have of artificial intelligence in healthcare today, just so everyone can really understand how these techniques are used today in practice. I will start with you, Rintje. Can you please give us some more details? You said you're working on this subject. What exactly are some of your projects and the applications that you're really excited about?
Yeah, thank you for this question. Well, I work with AI both in research and in clinics, as I said, and I can give 2 examples. So, for example, in research, we use AI a lot in both computer vision and in prediction modeling. Computer vision means that we try to automatically recognize patterns from images, and in our case, as orthopedic surgeons, from radiographs, for example. So what we do is projects on the automatized recognition of hip diseases in hip radiographs. The other thing what we're doing is in prediction modeling. So we're trying to predict using AI based on a lot of variables if people are going to develop hip diseases. And in our case, we do a lot of research on osteoarthritis of the hip. And we use AI as a kind of way to analyze a lot of data, a lot of different data like genetics, radiographs, biomarkers, blood samples, and all that things. And we use AI as a tool to make prediction models to estimate the chance of disease. So that's how we use it in research. In clinics, we use it also basically in 2 ways. We use it, it's more a digital history taking. So if you go to a doctor for your first consultation, the doctor normally has a lot of questions for you. People are mostly stressed during this first consultation. So what we do is we have a list of standardized questions for each specific complaint people have. They can fill this out at home. And in this case, if the patient comes to my for the first consultations, I already have a lot of answers to important questions. So that allows me a lot of more time to spend with the patient and allows the patient to fill out all those questions, relax at home. And the second example how we use it in clinics is that we use AI to track patients after an operation. So after an operation, we use wearables, for example, iPhones or some stuff like that. We use data like how much steps they do each day. We ask for questionnaires, etc. And by doing this, we can analyze with artificial intelligence how well the patient is performing after an operation. But we can also benchmark the outcomes to other patients who underwent the same operation to give live feedback to the patients how they are performing.
This is very interesting. Do you have an example of the way that your practice has changed, where you can tell us a bit how it was before and how it is now, and if that's better and if it helps you using those AI tools?
Yeah, well, I think the best example is the example from clinics. And what we did a lot of tests with patients, how they experienced the automatic history taking, which they can fill out at home. And what all the AI stuff we do in clinics, what we experience should have a benefit for both the doctor and for the patient, in order to get people to fill out the questionnaires they have to, but also the doctor should see some benefit of using it. What I found, especially for this automatic history taking, is that when the patient consults me for the first time, I don't have to ask all those repetitive questions, what kind of medications they use, what kind of other history they already have, and some other questions, which I will do for each patient every time. And that allows me to spend more time. So the quality of the consult is becoming higher. And we did research on that as well. And we actually showed that also the patients experience a better consultation with us as orthopedic surgeons if they use this tool.
Janek, jumping on what Rintje was explaining, he said that artificial intelligence can be used to predict the evolution of a disease or outcomes. As a patient, and we know we discussed when we prepared the panel, how would you feel about these predictive features that AI can bring? Is this something that you find interesting in your point of view to perhaps anticipate better some of the diseases that you might have in the future or the evolution of some of the diseases that you have? Or is this something that's quite terrifying and you would rather not know?
Yes, this artificial intelligence is mostly making predictions, and the predictions are based on the data and the quality of the data the computer has. So from patient perspective, I don't want to always know the prediction, because the prediction may be 90% I'm getting some illness or it is getting worse, but this is prediction. I always need to know from the doctor who can explain me this prediction, because if I only see it in my papers, I may be scared, and I don't want to know this. And because if I know that I am in a high risk, I may ruin my life. I may be overthinking and do anything. So all this artificial intelligent work should go hand in hand with the doctor who is explaining me all those predictions. And to come back to the data and the quality, I think patient should always know which part is done with the help of the artificial intelligence. Because like we heard, patients are doing at home the questionnaire. But we all know if I download some application, I have to accept the long juridic papers, but I only click accept and I don't usually read it. The same thing may happen with a questionnaire. I may just fulfill it really fast and don't think that someone will read it and will make some prediction from this. So if I know that this paper is crucial to my later what kind of care I will get, I may fulfill it with a more accurate data. So it's always good to know why I'm doing this. So I put more work to this paper.
If I understand correctly, what you're saying is that perhaps you would like to be informed if your physician uses AI or a type of predictive algorithm so that the input that you provide is better quality if you know that it is going to be used for predictions than if you don't know.
Yes, exactly. Because there may be some questions I may answer one way or the other. Maybe I want to show myself a little bit better, or I don't remember or something. I will just put, yeah, I'm okay. That's not me. But this may be the crucial question that would change the care I will get later. So it's very important to know from my point of view.
And this is really interesting because it leads us to this notion of responsibility and the fact that there should always be a human, and in this case, a doctor, whether behind the machine or between the machine and the patient. This is something that the World Health Organization has explored in its latest report called Ethics and Governance of Artificial Intelligence for Health. Samir, is this something, how do you feel about what we've been discussing so far? And what are some of the guidance that this report is providing, especially when it comes to the role doctors should have in regards to the machine and patients?
Thank you, Anca. This is a very important point, and it's glad that we're having a discussion. AI by 2030 is expected to be around $15 trillion market. So there is definitely a lot of it going. A lot of it will be in health as well. So there's a lot of potential that we're seeing already. Now, always remember, digital health and AI is and will be an enabler of healthcare services. It is not meant to replace a mankind, at least at that stage. The evidence that we've seen is there's a lot of enabling function that it does. As Rintje mentioned, in some of the image processing areas of work, in some of the high areas of work, we're seeing in rural Africa use of AI for screening treatment of cervical cancer, which is humongously expensive at this stage, over $100 in normal spaces. We have the potential of bringing it down to less than $1. So that's, I think, the potential that we're seeing as an enabler of AI. Having said that, as you rightly pointed out, there's a lot of ethical challenges in the AI, and we need to be alert and active together to make sure that this is a responsible and enabling function that we can use and not cause damage. So the report that we have released just earlier this year, called as it's available for everyone. The report is Ethics and Governance of AI for Health. It focuses on recommendations for different sectors. It focuses on recommendations for developers. It focuses on recommendations for governments, how to employ doctors, how to use it. And it builds on specific principles of protecting autonomy, promoting human well-being, even safety and public interest, ensuring transparency, explainability, and integrity, fostering accountability. That's an important one because you can't be putting blame fingers on others. Ensuring equity, and that's a very important one that we are seeing in the COVID times. Equity is critical for every action that we're taking. We don't want only one sector of people to benefit and the others will be left out to the dust. And then promoting responsible and sustainable use of AI, which is equitable across the planet. So that's, I think, the key principles. And as Janek mentioned, data is critical to this. So one of the functions of this ethical principles is around data as well. It's not about creating biased data sets to sort of make the point that your algorithms are working, but to try and make more harmonized validation processes where we're trying to get into this one. So the report actually is not just a guidance document. It has checklists specifically prepared for programmers. As a programmer, what do you need to consider? And so I encourage every developer of AI, every user of AI, who's encouraging to look at these checklists, see if you are actually binding yourself, make sure that you're doing the right things. There are experts out there which you can reach out to us to get in the guidance as well. There is guidance in that checklist for providers, as I mentioned as well, hospital systems, healthcare professionals. So the report is structured in providing that ethical and governance guidance to those who are inclined in making this AI. And WHO, as a responsible, is trying to make that happen with our countries, with our member states. Back to you.
In this report, what I found interesting is that you guys have screened a number of AI applications in healthcare to build those recommendations. We're at a time where we don't know how to position ourselves. Sometimes we're really excited with some of the developments. And then at other times we see, journal articles that tell us that AI is not as advanced as we think, that there are things that we do perfectly well, like image recognition, but other things where we struggle. From this screening that you've done, can you tell us a little bit where AI is standing today?
Yeah. Anca, again, as you mentioned, we should not generalize AI. AI is a huge word. When I talk of $3 trillion, there's a huge market out there. We have to look at the evidence. Science, it has to be science-based. We cannot rush into small data sets being validated and then giving it out. So WHO is working as we're doing the scoping. Image processing has a full advance, as you mentioned, but the application of image processing in the right sense, it's one piece of the broader puzzle. The cervical cancer example, which I was talking about, it has a huge potential. Diabetic retinopathy. There's a huge large-scale trials going on right now in Zambia, in Senegal, on diabetic retinopathy as well, in Zambia on cervical cancer. And these will provide the science. So I would urge everyone to look at science. What we're trying to do is look at where the science is. We cannot rush into it. AI does give the benefits. I mean, it has the potential to provide us that science in a more different and faster mechanism. So we want to look at and not generalize AI, it's successful or not successful. We want to use NLP in some form, but NLP is not there for medical at this stage. We're still trying to get into those stages. So when the evidence comes out, we recently saw very nice sort of science on TB detection and management, which was released in Nature and Lancet, it showed that the use of AI has shown evidence in higher predictability, much better outreach. So where the science is taking us, and that's where we need to follow and sort of advance the AI means. And I think Rintje and colleagues like him are the ones who are generating science, and I think that science has to basically monitor.
That's really interesting. And Rintje, I'd like to sort of pick your brain on that, because you work on AI projects. And for people that are not experts in this field, like many patients, sometimes we feel like, we have a lot of data that some way goes into these algorithms, and then there's a prediction or an output that comes out of it. And we talk about this famous AI black box. As someone who engineers that black box, can you tell us a little bit what happens behind the scenes, and how do we get to these predictive results and to everything AI can do for healthcare?
Yeah, sure. That's indeed a very interesting question, because in medicine, we actually don't want to have a black box. So, for example, some might be interested in only the prediction itself. For example, Facebook, that's only interested in which products you want to buy and have their advertisements based on, for example. So they are only interested in the outcome, but are not interested in the variables that predict that outcome. So then it's a black box. If you want to use it in medicine, we actually don't want to have a black box in this prediction, because we want to understand the prediction, because we want to do most of the times something with the variables that predict the outcome. Let me give an example. If we are in a research setting trying to predict osteoarthritis and who is going to develop that, and we want to only have variables that we can interpret and that we might act on if necessary. So we only want to have variables into that algorithm that we can understand, that we can possibly change, and at least that we can interpret what the results are. So that's very important difference between having AI in medical sciences and in prediction models for diseases. And that's very important, especially if you want to predict the disease, because Janek had a very good point on the ethics part, and we will probably discuss further on that. But if you want to, you can predict a lot of things with AI, but if you want to predict the onset of a disease, then the ethics is, of course, very important, and how you handle that.
Janek, maybe you would like to jump on that?
Yes, I'm really excited, actually, that there are so many artificial intelligence already in the work of the medicine and the doctors, helping them to do the right choices. But like the wearables, I would love to know how the readings and what kind of readings are the ones that actually doctors need. Because if I know which kind of information they need, I also pay more attention. So the data that is saved from my wearables will be higher quality. Let's say if I walk outside or whatever, I know that they are reading this exact data from my watch or phone. So I pay attention that I get a good result, because from this data, there will be the better care. But if I don't know, then I may jump and do who knows whatever, and the data is bad quality. So this is one point. And it's always good to take the patients from the first steps on board. So if I am coming to the doctor, I know that the artificial intelligence is one doctor, and we work together. So I am also interested about the outcome, and I know why this is being done, and what's happened in the future with my data. And if I am putting more energy to this project, I know I'm actually doing the good for the other patients also. It's not only me who is benefiting, but the data, the good quality data will be saved and used later to get better cure for the others. So it's like clinical trials I'm doing.
Right. And what's really interesting about what you're saying is that you say that patients should be informed. At what stage do you think patients should be involved in developing AI solutions? Do you think, in your opinion, from your standpoint, would you just want your doctor to inform you that some of the input that you might provide him will be used for these algorithms? Or would you like to work on conceiving and designing and building these algorithms, which is a completely different type of involvement? Where would you stand? And do you have any idea of what patients in general, even if you cannot generalize, where the trend stands? Is it more just as a, let's say, end consumer, informed end consumer, or really involved in developing these solutions?
I don't think that there are too many active patients who want to be involved in the full process. I think most of them just only want to know that the data is being used and analyzed with artificial intelligence. But patients like me, who is really interested and are willing to invest time and energy, I would love to be in this project from the start. Because as I'm also patient advocate, then I know how to explain if someone is from our organization asking me, hey, I went to the doctor and they said there is artificial intelligence involved, and what does it mean? And if I don't know, it's embarrassing. But if I am also involved, then I can tell him exactly why it's being done and what's good it's coming out. So it's like a win-win for me.
Right. And you're mentioning transparency, and this is something that was also developed in the World Health Organization report. Samir, maybe you can give us more insight into that. The fact that patients want more transparency also comes with the fact that doctors themselves need to be aware and informed so they can spread the information. Where do doctors stand today? Are they generally well informed, or is there much work to do? What are some of the insights from the report?
I think there is, it's not just the patients need to be aware. I think everyone wants to know what's happening, because intrinsically a person, himself, even if it's a doctor or healthcare provider, is also somewhere down the line a client of this AI services. So the transparency is key. And as I mentioned, one of the consensus principles is around transparency, explainability, and the integrity of these solutions. We of course, the principle talks about keeping and protecting your autonomy, but knowing what's happening on this. And as Janek mentioned, the intention, once it's clear and transparently put out, will definitely encourage more and more sort of validated data to be available. Now, there is definitely a lot of work that needs to be done. I mean, AI is an evolving field. There is a lot of misinformation about it. There's a lot of scare, as you mentioned, about it. People thinking that the robots are going to take over lives of doctors, and doctors are going to be replaced with robots coming in and doing treatments. What we're seeing right now, we want to use AI as an enabling function, and that needs to be understood. The value, the functions of AI, the quantum mechanics that can allow and help doctors to faster analyze, to faster get some solutions, to do something which is not probably very easy for naked eye or some of the equipment with the rural level to do. That benefits need to be communicated properly and made available, again, based on science and evidence. And that's where it will come in. So there is definitely a lot of work to be done. But at the same time, there is a lot of excitement also. I have to say that when we have a group of experts we've been talking to countries, the ministries of health, the ministers themselves, there's a lot of enthusiasm in terms of taking this on board. But the scare is in terms of the ethical application and use. And I think to make that successful, or to make that knowledge spread very sort of in a rapid fashion, every stakeholder involved needs to be actively doing their job. It's not a police mechanism that we can set out and say we are the police and we're doing the ethical policing here. As a developer, as a provider, we have to ensure that the ethics and governance are understood and deployed. So I think it benefits us all, and that's where I think we are looking at these recommendations is to make sure that we are together as a group working. And one of the next steps in this report is to build that education also for the providers.
So in your opinion, from what I understand, one of the main challenges that you identify is education around this topic. What are perhaps some other barriers that you think we can act upon quite rapidly to, of course, raise awareness more about the use of AI, but also reassure patients that about the applications and the real use that we can make of this technology?
I think one of the big areas is the lack of valid data sets that are being shared out there for validation of these AI algorithms. I think there's a lot of potential, but we don't, as I mentioned, the focus has to be on science. We don't want to bias these algorithms and go into a rush and say that this is working when it's just tested on a specific set of data. And then we are creating mistrust further on. So I think one part that we can do is to encourage that open data concept, open sharing of data. I often give the example of particle physics, where technology has advanced because over 90% of the data in particle physics is open source. And so there's a lot of research successfully happening there. In public health and medical sciences, that's close to 18 or 20%. So obviously we have a big gap. So that's one thing that can help as providers. Everyone is doing something to come together and make sure that those data sets are validated. The second part is, I think, building the second set of wave, our future generation of our healthcare providers. It needs to be integrated in medical curriculum. Digital was an enabler in the past, but to a very small extent. Now it has a much more potential. If we don't start integrating this into our curriculums, into the trainings already, it will take time much longer and create anxieties. If we put this science in the schooling, in the education itself, that will definitely help us rapidly endorse and absorb AI as we go forward.
This is interesting, and Rintje, maybe you can build on that, because there's been this moment in time where we heard a lot of negative feedback from healthcare professionals. Some of them were scared that AI would replace them. I think that this is something that we are educating healthcare professionals on. And today, I feel like they're more open to working on AI projects, even using AI in their daily practice. Have you seen this evolution? Can you confirm that? And what's your standpoint on this?
I can certainly confirm that. And I actually think there's still a lot of doctors are afraid to use it, both doctors and patients, actually. I think once they use it, they have to see the benefits. So both patients and the healthcare providers, the doctors, for example. What we found out is, for example, when we did this automatic history taking, that in first instance saved the doctor a lot of time. So they were quite fast, pretty happy with it. But they also experienced that the patients were happy with it because they could have the history taking like relaxed at home and they weren't stressed. So that was one thing. The other thing, when we had a kind of database of all those answers and we knew what type of diagnosis after the first consultation, what type of diagnosis the patient got after that first consultation. We now also do the prediction modeling of the diagnosis. So not a prediction of a disease, but we only use it for if they fill out the questions before the consultation. We say, you are involved in an AI project. We're going, based on your answers, we're going to estimate what the most likely diagnosis is. And for example, you have a diagnosis of 80 or 90% of hip osteoarthritis. In the consultation, the doctor will confirm that or reject that. but the chance is pretty high that you have this diagnosis. So here's some information you can read about the diagnosis. You can read already before the first consultation what the possible treatments are. So you can also have a better discussion with your patient, because the patient is better informed before the first consultation already. And it is good to realize that the prediction the algorithm gives is not per se the answer. I mean, it can be that the diagnosis will be completely different. So that's a way that you have to communicate very well. And only the automatic history taking, a lot of doctors were already scared for that, because they say, well, I have to pose the question in this way or in that way. And if there's a standardized question, I never get the right answer. Well, we did studies on that. And actually, we had to do trials, of course, on how to pose the question. But in the end, you can standardize, I think, 80% of your consultation and the questions you pose in a pretty good fashion. But I think it's good to communicate with patients as well that, for example, if you give a prediction of a diagnosis that might not be the diagnosis they will have, that it's always confirmed by a doctor, that they will always see a doctor. I think it's far and far in future, and it will maybe never be there, that the doctor will be skipped. I think both the doctor, but also the patients, I think they need that human contact and the real consultation. But using AI with all those applications, you make that a better quality patient consultation, and which makes it also better for both the patient and the doctor.
Right, and this is where the notion of empowered patients and active patients and informed patients is particularly important, because as we all know, when you have, some symptoms, you type them on Google, and Google says that you have, some type of cancer or something like that. And you kind of take that for your diagnosis. And even if you know better than that, that you know that you still have to see a doctor, that Google doesn't always say the truth, it still creates some anxiety and fear. So I imagine that if you fill in those questionnaires and this system tells that this is a probable diagnosis, you will kind of feel the same way as with Google. You kind of feel stressed and feared that this might actually turn into reality when you see your doctor. So I think there's always a bit of education to be done here, and also let the patient decide, do I want to see the predictions, or would I rather not see the predictions and just wait for my doctor to talk to me and have this human interaction first? How do you feel about that, Janek?
Yes, I totally agree that at this point, I think it's better to give the result with doctor, or at least from doctor, because we don't know how strong the patient is, and is he ready to get this bad news from the computer, and what's happened next. So I prefer that only the strong one can box that I can handle the result myself without the doctor. So I would prefer with doctor get the results.
And in your opinion, what are still some of the biggest obstacles that would keep other patients from feeling reassured when perhaps the doctor tells them that there's this AI that is helping them in the decision-making process? What are some of the pieces of the puzzle that are still missing?
I think even today, if the doctor, without artificial intelligence, is telling you some kind of strong diagnosis, you still go and Google it. You may have a relationship with a doctor that you actually don't trust 100%, because not all doctors are patient-oriented, because we still get that, I know what's good for you, but this has to be changed. We are both equal partners, and I need to know what's good for me and why this is good for me. Example is that how many people are taking the antibiotics to the end. If I'm feeling good, I'm canceling most of them. So you have to raise the awareness why you have to do it. So same thing is with the doctors, that they have to already today patient-oriented approach that you have to know why you have to take this and what's happened next. So it's complicated even today for some patients, even without the artificial intelligence involved.
That's true. And what I find funny in what you're saying is that you said earlier that the quality of the data you provide to your healthcare provider or a system depends on you knowing whether there's AI and prediction behind it. So what's funny is that you ask yourself, should I give better information if there's AI? But shouldn't you always give better information, just because the doctor can also be influenced by the quality of the information that you provide? Why is it that you ask this question when it comes to AI, but maybe not when it comes to your doctor?
Because there's too much paperwork, and the doctor has too little time, even for you. When you go to see the doctors, most of the time the doctor is typing. Sometimes even with one hand, and he don't have time to look at you and talk to you. He's looking at the computer and typing the information. So that's why I don't think that the doctor read all those questionnaires I am fulfilling. So if I know that this is done by computer and the results is done and put to the doctor's screen, I, of course, put more energy to it.
Right. And this really illustrates how complementary the work doctors do is with all the insights that artificial intelligence can provide. I suggest we move on to some of the questions, because I see we have a lot of them. Before concluding, I see here some questions for Rintje. How do you organize the first collection of data before meeting your patient?
Oh, thank you for that question. We use actually an application on a mobile phone or tablet or on your laptop computer. And this app is called the Patient Journey app, we call it. And we follow the patient from first referral to the end of treatment, basically. So in the Netherlands, there's a pretty strong system in which patients, if they have a complaint, no matter what, they first always have to consult a general practitioner. So people can't go themselves directly to a specialist. So they have to go to the general practitioner first, and the general practitioner refers the patient to a specialist if necessary. So in my case, if people have complaints of their skeleton, for example, hip pain, knee pain, or whatever, and the general practitioner thinks this patient needs to see an orthopedic surgeon, he or she refers the patients to me, and he or she indicates what type of complaint this patient has. Well, based on the type of complaint, for example, hip pain, and based on the age of patients, the patient gets via their app, they get all the questionnaires and the relevant questions we want to know for this specific complaint and type of patients. And there are a set of questions we want to know for everybody, like the kind of medications they use, the allergies they have, and etc. And we use that in a patient journey. So from the first referral, they got the questionnaire, they come to the first consultation, and that's actually the best way we change practice to if I may, to complement the comment on from Janek, because previously we indeed were only typing and couldn't speak really to the patient, but only typing. And nowadays I don't have to type anymore. Sometimes a few words or letters, or sometimes you have to adjust a little bit the history, because it might be people that have misunderstood the question or misinterpreted the question. Sometimes you have to adjust a little bit, but I don't basically have to type anymore, so I can really face-to-face speak with patients. So that's a great advantage. And the patient journey apps follows the patients in time. So when they finish the first consultation, I provide them with a diagnosis. They got pieces of explanation and information on this diagnosis a couple days later. So the day after the first consultation, they got information. The doctor said, explain this and this type of diagnosis. Here you get some more information on this diagnosis. And 1 week later, they get more information on it. So in pieces and bits, the patient gets information on the diagnosis. And we do actually the same on the treatment. If the patient comes further and you decide for a treatment or a surgery, in this case, for example, the patients get days before the surgery, they got a lot of information on why we're doing the surgery, how they can prepare, etc. And also what I said, after the surgery, they also get, they can fill out, if they want, a lot of data, for example, how they can walk stairs, how much pain they have. Because what we experience in clinics, there are more or less, I don't want to generalize, of course, but more or less two types of patients. Patients that are that can be very anxious and insecure when they're at home, and patients that are too secure, basically, that we want to see more earlier. Actually, the patients that can be insecure or anxious at home, if they fill out that they have a pain score of, for example, 7, we can benchmark them to all other people that underwent the same operation. And we can either say, well, 7 is actually pretty normal in this case, so we can comfort the patient, or we say, no, it's actually pretty high for this type of operation. Please ring the hospital, because we want to see you and to adjust that. And also for the patient that might be too secure after the treatment, we can say, hey, we see that you're not walking very well or not walking very fast, or you have a lot of pain. So please call us and maybe we have to adjust something. So that's how we use this app from the start, from the referral towards the first consultation, the treatment, and after the treatment as well.
As a reaction to what you were saying, we have someone that said, indeed, for example, in China, doctors only have 2 minutes per patient, and this would be a huge help for them, even more with a doctor network. Another question for you, Rintje. Can you share insights on the discussion where AI is part of the treatment for a patient? How do you approach the subject, and how has it been received?
Yeah, that's something what we still use in a research setting. So we don't use that yet in a clinical setting, which will come, I think. And how we are using that is we are now collecting data of people, how they're performing after the operation. And we now use that, as I explained, to give them live feedback and to benchmark their results towards the other patient that underwent the operation. But what we in the end want to do, but that's also pointed previously in this discussion, that you need to have very good validation data if you want to use it, in this case, for your treatment approach. But you can think of something like, so if we do surgeries for a total hip replacement, or a total knee replacement, we know that for a total knee replacement, for example, 80% of the people are very satisfied afterwards, are very happy. But there are also 20% of people that are more or less not satisfied, if not completely satisfied. And it's very hard to predict why that's the case and who is going to be that 20% that's not that satisfied. And you might think of, if you have enough good quality data, you might think of how to use that in a prediction of how well people respond to a certain type of treatment. So you can much better personalize the treatment for a specific patient. Again, we use that in a research setting, not yet in clinics, but that's probably coming.
Thank you, Rintje. Samir, we also have 2 questions for you. How different are the AI concerns for patients in Europe as opposed to Africa?
Yeah, it's a very interesting question and a very clever one as well, I would say. I think there's not one single direct answer to this. There is one underlying set of concerns which goes across, which is geography independent, personality independent, and which are tied to the ethics, the time of the validity of these ones, tied to the knowledge of AI. And then based on the access and the availability of these technologies in the regional settings, whether it's in countries like Belgium or in Switzerland, there's much more access to this. So obviously the concerns there are a lot surrounding data, appropriate use of these data, the regulations, the governance, and the application of these data sets to the right valuable products. Whereas in Africa, there's still, not only Africa, but even in Asia, Latin America, a lot of it is still about access. How can this benefit? What does it actually mean? So there are some which are region-specific concerns, but the generic layer of concerns is, I think, similar across the board with patients, and which are genuine factors. It's genuine questions, and that's why I keep on saying that everyone who's in this space needs to do the active job of educating the people, the patients, the caregivers about the rights and the wrongs of AI, and using that to the optimal for future growth.
The second question we had for you is whether or not the World Health Organization works with the European Commission regarding AI in healthcare, because much is happening at the EU level, like the European Health Data Space, AI Act, etc.
Indeed, yeah. I mean, we work very closely with a lot of the AI agencies globally, including, of course, the EU. There's never enough collaboration. We're always open to partnering and discussing more, but we have been working very closely with the European Commission. Some of the big countries which have huge portfolios on AI, whether it's the AI Singapore, whether it's Saudi and Saudi, we work very closely to try and garnish the knowledge that has been generated, the lessons that have been created, how they can be replicated. I mean, WHO is a convener, so our job is to make sure we look at where the gaps are and try to fill them up with what is existing, what is learned from different areas. So there is a lot of collaboration with the European Commission, even the African Union. There are several other agencies that we collaborate with and bring together. Other UN agencies, ITU, which is the International Telecommunications Union, specialized in work with the Ministry of Telecommunications, regulators, different country regulators, FTAs. We work with them. So there's a lot of collaboration that's happening. But as I always say, I mean, this is not something that we can put a cap on. Collaborations and knowledge is always open to be shared. So I'm openly again saying to everyone, if there is work that you're doing which can be shared, which can benefit the world, please do reach out to us through networking platforms that this Congress is set out. I'm happy to discuss further one-on-one also how to plan it further.
Talking about initiatives at the European level, Janek, have you heard of any work that's being done to help patients better understand the stakes of these new technologies, such as AI? Have you come across any of them?
Not really. I only know that there is the project that all the medical data is being done the way it is accessible all over the Europe, so you can do the clinical trials and also research. And the same thing actually comes to the local level, that the older the population is getting, the more we realize that the patient may have multiple diseases. That means multiple different doctors and different hospitals. And if the data is in all those different places, even if we have artificial intelligence, it doesn't have the information from all those. So the outcome may not be as good as it could be. So it's really important to see this thing already today and start working, because after the pandemic, we start traveling. And if something happens in some other countries and the doctor can't read my information and see that maybe I have some allergy or something, it may be really bad for the patient. So it's really good to work today so we have the access tomorrow and better predictions.
And just for patients that have questions about artificial intelligence in healthcare, there are a lot of resources on the European Patients Forum website that you can access. I also encourage you to take a look at the World Health Organization website, where you can also find a lot of resources. The report that I was mentioning, that is also very well written and very comprehensive for everyone that's looking for information. It's called the Ethics and Governance of Artificial Intelligence for Health report. I have a last question for you, Rintje. Does AI accelerate the process of diagnosis and identification of best treatments or therapies?
Oh, yeah, I'm certainly it does. It's absolutely beneficial for that. So AI helps, in my opinion, a lot with a more personalized approach for both diagnosis, but also for treatment. But the key here is to have the right data set, a large enough data set, and a validated data set. So to give you one example, we are research-wise, we are now trying to make prediction models for hip osteoarthritis. And how we're doing that is to collect all prospective data on hip osteoarthritis, which is available in the world. So we collected data of 8 prospective cohort studies that are available in the world. So this is all data on hip osteoarthritis in the world. And based on that data, we are going to make prediction models. So that sounds great. And in a way it is great, but people also have to realize, and we realize, that all those cohort data is from Europe, America, and from Australia. And these are the countries that have those data available. And from the other continents, there's no data available. So what's going into those prediction models is also the data from America, Australia, and Europe. And we have to make sure that the prediction models are generalizable to the whole population as well. So that's, I think, something that people have to realize, that AI can help us a lot. Can help us really with personalized medicine, but we really have to think about the generalizability of the models we create.
Something that I hear from the beginning from all three of you is this discussion about the quality of the data sets that we use to build these algorithms. And perhaps this is something, one of the key takeaways of this discussion is to, as a patient, when you provide your data, you know now that some of that data may be used secondarily even to train these models. So perhaps we can say that as patients, we also have a responsibility to provide accurate information to our healthcare providers, because in the future, it will probably come back to us in a way or another, and we will be impacted by the very quality of the information that we first provided. So maybe this is one of the concluding elements. And I'll let you, all three of you, also wrap up this conversation with what are for you some of the key takeaways. Maybe starting with Janek.
Yes, the most important as the artificial intelligence capability are as good as the intentions is made for. So the same thing that if we only have white male data, then we cannot predict African American diagnosis. So it's very important to understand that the more there is the data and the higher the quality, the better for all patients all over the globe. So let's share the data globally and the quality, high quality data.
Thank you, Janek.
It should be secured.
But maybe before letting you guys conclude, I'll just drop in a quick question. Maybe Samir, you can address that about the biases in AI, and this links to what Janek was saying. What are some of the safeguards in place to make sure that those biases are reduced?
Yeah, I think we've discussed this intrinsically. Rintje and myself, and I have said that it's not about getting a small data set to validate that specific algorithm. That's obviously a bias that it's creating. So what we need to do is make sure it's validated across a spectrum of data sets, large-scale data sets, to avoid and minimize any errors and increase the sort of response of these areas. And that's why I think the ethical governance is crucial. It's not about me saying my algorithm is the best. It's about me putting out my algorithm and challenging anyone to test it across the board, having everyone say, use it against your data sets, try different data sets, and then the results are matching. That's how you come out. I think that's where the ethical principles have to be self-absorbed by everyone. And that was my key message also, Anca, throughout this discussion is, of course, AI is an enabler. We can use that as an enabler, but we have to all do our job in making sure it's ethically and wisely governed to make the maximum impact out of it.
Thank you, Samir. And for the concluding word, Rintje?
Well, I think it's important to know that AI is a great tool to support us in a personalized way to diagnosis and treatment. But always remember that it's a tool that helps us and will never, I guess, replace the patient-doctor relationship.
Thank you all very much for participating in this panel. We are wrapping up today. Thank you to all the speakers and to all the participants, and I hope to see you again very soon.
Thank you so much.
Thank you.
Thank you.